So, have you ever really stopped to think about what it takes to keep an entire country, or heck, the whole world, healthy? I mean, it's a massive undertaking, right? One of the biggest projects humanity has ever tried to pull off. In this explainer, we're going to trace that exact journey, from this one powerful idea all the way to the huge, kind of complicated system we see today. Yeah, so what does it actually take? What are the blueprints, the nuts and bolts, and of course, the money you need to turn this big idea of health for everyone into something that really works on the ground for real people? That's the big question we're going to dig into.
Okay, so here's how we're going to break it all down. First up, we'll look at the vision, this whole health for all idea. Then we'll get into the nitty-gritty of building a health system. After that, we'll tackle the big one, how we pay for it. And we'll wrap up with a little financial checkup to see where we stand today.
All right, part one, health for all, the vision. And to really get this, we've got to go back to a landmark moment, the 1978 Declaration of Alma-Ata. This is where it all started, a meeting that basically set the moral compass for everything that came after in global health.
Just take a second to really read this. A state of complete physical, mental, and social well-being. Back in 1978, this was a huge deal, a totally radical idea. They were saying health isn't just about not being sick, it's about being, well, in every sense of the word. And the craziest part, they declared it a fundamental human right for everyone.
Okay, so health for all is the big dream. But how do you actually get there? What's the plan? Well, the answer was something called primary health care. And the key thing to get here is that this wasn't about building giant, fancy hospitals in big cities. Nope, it was all about making the essential, practical stuff accessible to everybody, right where they live.
And just look at what they meant by that. This list, it shows you just how big they were thinking. It's not just about pills and shots. It's education, it's food, it's clean water and sanitation. They totally understood that you don't find real health just in a clinic. It's built in our homes, in our schools, in our entire communities.
Okay, so that's the why, right? The big vision. Now for part two, building a health system. How do you actually construct this thing? For that, we're going to look at the WHO's 6 building blocks, basically the essential ingredients list.
But first, let's make sure we're on the same page about what a health system even is, because it's way broader than you might think. We're not just talking about hospitals and clinics. It's everything. It's the mom taking care of her sick kid. It's the private doctor's office, the insurance companies, even the laws that make our cars safer. If its main goal is to promote, restore, or maintain health, it's part of the system.
So here they are, the WHO's 6 building blocks. You've got your service delivery, the actual care, the health workforce, the doctors and nurses, the information systems to track what's going on, all the stuff, the medicines, vaccines, and tech, the financing to pay for it, and finally, leadership and governance to steer the ship. The most important thing to remember is that these are all connected. Think of it like a Jenga tower. If you pull out any one of these blocks, the whole thing can come crashing down.
All right, let's zoom in on that 5th block, financing. Because let's be real, it's one of the trickiest parts. None of this amazing stuff happens for free. So how do we pay for it all? Historically, there are really 2 big, foundational models that have shaped how countries answer that question. So you've got 2 main flavors. First, there's the Bismarck model. Think Germany. This is where both you and your employer chip in to these things called sickness funds. Then you have the Beveridge model. Think the UK's NHS. This one's funded straight out of general taxes, run by the government. And here's the fundamental difference. One system is tied to your job, the other is tied to you being a citizen. That one little distinction changes, everything. It changes who gets covered and even how stable the system is when the economy gets shaky.
Okay, so with those 2 models in our back pocket, let's jump to today. Part 4, a global financial checkup. Let's look at the current trends in health spending. Where's the money coming from and where is it actually going right now? The latest numbers are pretty interesting.
Check this out. This chart shows something pretty remarkable is happening. Right now, health spending is growing faster than the entire global economy. But the real story is where it's growing fastest, in low and middle-income countries. We're talking more than 6% growth every year. That's way faster than in high-income countries. This is a huge signal that priorities are shifting all over the world.
And let's put a real number on that growth to make it sink in. $60. That's the average that governments in lower middle-income countries are spending per person on health. Now that might not sound like a lot, but here's the kicker. That number has literally doubled since the year 2000. It's just clear as day proof that countries are stepping up and investing in their own people's health.
So that's domestic spending. What about money from the outside, international aid? Well, as you can see here, it's super focused. We're talking almost half of all that money targets just 3 diseases: HIV/AIDS, TB, and malaria. Then you have another chunk for reproductive health and non-communicable diseases, and the rest is spread out.
So, what's the big picture here? What does all this add up to? Well, we're definitely in the middle of a huge transition. More and more, countries are taking the driver's seat, funding their own health systems. That's the big story. But, and this is a big but, international aid is still absolutely critical, especially for things like childhood immunizations and for building up the global defenses we all rely on to stop the next pandemic in its tracks.
And that really brings us full circle, doesn't it? We started with that incredible vision from Alma Ata: comprehensive, accessible healthcare for every single person. We've looked at the building blocks you need to make it happen. And we've seen that there's more money flowing into global health than ever before. So it all comes down to this one final, really important question. With all these resources, with all this momentum, are we actually building the kind of smart, fair, and strong health systems that the world truly needs?